Okay, so this talk is sort of a continuation of imaging the elite athlete, but we're gonna move more toward nuances that are related to particular sports. So sports specific imaging considerations, things you want to think about when you're imaging athletes who play a particular who do a particular activity. So football is obviously a violent sport, right? And certainly we get traumatic leg injuries and arm injuries, but we also get traumatic injuries to the axial skeleton. And sometimes these injuries to the axial skeleton are more difficult to image. And sometimes they create problems. So often we have to think it through. Here's a quarterback who got crunched in the pocket, got hit from both the front and the back, and he's got real soreness at his sternoclavicular joint region. His x-rays were normal, and the team wants to know, does he have a fracture? So they started with a CT. They often start with a CT. CT has this reputation among sports physicians as being the best imaging tool for fracture. It certainly has high resolution. Whether it's the best for fracture or not, I think that MRI is so sensitive for bone marrow edema. It often helps us out in ways that CT can't. And in this case, I've got fragmentation here at the periphery of the manubrium. Is that trauma, or is that old? Is that just him? I have no idea. Is this little fragment at the sternoclavicular joint real? I really had no idea. So I recommended we get an MRI. Certainly the MRI wasn't beautiful to start. We used too small of a field of view here, but then we increased a little bit and we started to get some reasonable imaging. There's just an inversion recovery sagittal sequence, and look at that. So there's no more question about what's going on. I saw a little gap on CT on the sagittal reformats, but I didn't see this big hematoma. So he's got a sternocmanubrial separation and a big hematoma. And the diagnosis is made, the problem is solved. Here's a defensive end who had a similar traumatic injury to his sternoclavicular joint. He was in horrible pain. He couldn't even lie still for the imaging without sedation. And the CT showed not much. Maybe this is that something? I have no idea. The MRI shows a big sort of periosteal sleeve avulsion from the clavicular head with a big surrounding hematoma. And we get these a lot. Here's this hematoma on a sagittal view, really nice. Here's a running back who fell on the football, and in this case, it's the right side. He's even got a little fracture at the costosternal junction. And he's got a separation here of his sternoclavicular joint with fluid and blood sort of leaking out everywhere. And again, the sagittal sequence sort of helps us. So MRI can be your friend. CT plays a role as well, but